Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hello and welcome to another episode. So this has a lot to do with the time of the year that it is today's Ask the Chiropractor. Every year at this time, people come in and tell me that they had a school physical and the doctor thinks their child has a scoliosis. And that's all. There's no follow-up, there's no what to do next, just I believe your child has a scoliosis. So let's talk about what this is, what a scoliosis is, and why this happens so often this time of year. First, it's back to school, and everybody wants to go play sports. They have to have physical certain years in your education, and so you're forced to have a physical. Now, in the great state of Illinois, the Illinois Department of Education has said that chiropractors cannot perform back to school exams. I don't know how this became. I don't know why it's a thing. We're allowed to do physicals in many other states. We are trained, we are tested, we pass national boards on being able to do a simple physical, but the Illinois Department of Education has decided that we cannot do them. And it's been going on a long time. Those of you who know me know that my father's a chiropractor, and my father couldn't do my school physicals either when I was a student. So this has been going on a long time. Chiropractors cannot do your school physicals, so therefore you're forced to go to a medical physician. Now, the medical physician will often, during the school physical, have you turn around and bend over and touch your toes. And they're looking to see how your hips line up, how your back lines up, and shoulders line up. If they see a little deviation, all too often, they jump the gun and tell you have a scoliosis. This is a bad test to determine whether or not somebody has a scoliosis. And it's also a very aggressive diagnosis, especially to a young teenager that might be having some self-image and some self-esteem problems to tell them they have a scoliosis just by one simple bend over, touch your toes test. As a father of 4 daughters, I don't think I'd like a doctor to tell one of my kids that quick without knowing for sure, without doing some type of confirmation test on it. And there's only one confirmation test that I know of that can determine whether you have a scoliosis for sure or not for sure. It's 100% accurate 100% of the time, and that's a full spine x-ray. Full spine x-rays always show that, and that's what we do here as chiropractors. We take x-rays of your spine, your whole spine, and we look at it top to bottom. It's all too often when a parent comes tells me, hey, I need to go find a new doctor. I said, what happened? My child had a school physical and the doctor told her that my child has a scoliosis, but you have a full x-ray of my child you did a year ago, 6 months ago, 9 months ago, and you told me the spine was very straight, there's no scoliosis at all. I don't want to go back to this doctor because this doctor must not know what they're doing, because I saw the parent sees the x-ray. The parent can see it's not there. It's not that challenging, really. And you just take the x-ray, you hang it up, and if it's straight, it's a scoliosis. What does a scoliosis look like? When you look at an x-ray, a scoliosis would be like an S shape to the spine when you're looking at it from front to back. As chiropractors, we look from back to front, right? We have the x-rays are in front of us, so it's like we're looking at you from behind. And that view, the front to back view, should be a nice straight line. The spinuses and the vertebrae should all line up perfect. But if we see 1 or 2 turn, that's typical. We typically see in a spine. We call that a subluxation. But when we see a whole group of them turning and forming a C shape, and then goes the other direction and a counter twist the other direction, a counter C twist, like a concave and convex, 2 different curves going back and forth, then we start talking scoliosis. And again, these are like really easy to see on x-ray. Really hard to see without one, unless it's a really bad one. Again, without the x-ray, I don't know how someone could tell a child they have a scoliosis. I just don't think it's responsible personally on my own soapbox to tell a young teenager something like that without knowing for sure. So if you go and you have a school physical and the doctor says, I think you have a scoliosis, take a deep breath, relax. There's a really good chance you don't, because I tell you, majority of the ones that come into my office are told they have that It's very far and few in between that we find they actually do. Heck, I had a kid come in here one year. The doctor had him do that and said, you have a full-blown scoliosis, fitted him for a full body brace that went around his entire thoracic spine, and took him off of all sports and never took an x-ray. Can you imagine that? This kid's wearing a full body brace, no sports, 14 years old, and told that he's going to have scoliosis the rest of his life and his back's horrible. Dad brought him in and said, I can't believe this. I said, I can't believe it either. We took the x-ray and the spine was perfectly straight up and down. I even did the ones where I had him change different positions and we did different things. We could not make a scoliosis appear on the x-ray. I took that stupid back brace and I threw it right in the garbage can where it belongs. But that's, again, when you get a diagnosis of a scoliosis, or the doctor suspects a scoliosis, I cannot tell you how important it is that you ask a chiropractor whether or not you have a scoliosis. Ask the chiropractor to take x-rays. So if you go to your school physical and the doctor says you have a scoliosis in your spine, and there's no history of scoliosis in your family, and nobody else in your family has a scoliosis, this is typically something that's seen from grandma to mom to daughter, but that doesn't always apply. But if nobody in the family has a scoliosis, and randomly you're just one child has a scoliosis, raise an eyebrow. Don't think that's factual. Don't just accept that, as I'm trying to say. Go verify with a chiropractor. And for whatever you do, don't ask the doctor, should I verify this with a chiropractor? Because you don't know the answer to that question. They're going to say, the chiropractor wouldn't know this, because that's always what they say. But we know this inside and out. This is everything that we do. The majority of my education to become a chiropractor was looking at an x-ray and evaluating a spine to see if there's misalignments. That's like a dentist. Ask a dentist, is it okay if I look at your teeth? Of course a chiropractor is going to look at your spine for alignment. That's what we do. So if you have a child that's been told they have a scoliosis from a school physical, by all means, don't keep following up that avenue. Like I said, that poor kid with the back brace, don't go down that road. Go see a chiropractor. And if the chiropractor doesn't take films or doesn't want to take films, then go to a different chiropractor. Find a chiropractor that takes films of your spine. Have the chiropractor evaluate what's going on with that spine. See if there really is a scoliosis. It's possible for me to have exercise one day, go to bend over the next, have a really sore muscle group somewhere in my body, maybe a hip flexor, maybe the piriformis on the opposite side. I go to bend, I've been a little crooked, a little cockeyed. Does that mean I have a scoliosis, or does it mean I have a sore muscle? It means I have a sore muscle. Do I have a scoliosis? In 1988, they came to my school in Evanston, Illinois, and they did a back check on us. They had us do that test. Everybody had to bring a swimsuit in that day, and we had to bend over, touch our toes, come up. I said, how's my spine? They said, oh, you got some issues in your spine. And the reason I know it was 1988, because my father was chiropractor of the year in the state of Illinois that year. And I turned around and I looked at him right in the face and I said, really? My back's bad? They said, yes. I said, would it mean any difference to you if my grandpa was a chiropractor and my dad's currently the chiropractor of the year? Without even a reevaluation, you know what? My back healed itself. I got better real quick. They told me my back was actually right. They misspoke. Make sure that you follow up with a chiropractor. Don't accept the definition of a scoliosis by simply bending over and touching your toes. That is no way to evaluate a scoliosis. That's a good test. It's a good thing that maybe we need to take a next step or this and that. But I've seen kids with horrible scoliosis that pass that test. They have really bad scoliosis. We see an x-ray, they touch that test. Mom or dad looks at them and said, do you see a scoliosis? The doctor says no. But we've seen the x-ray. We know it's there. So do not, if any doctor tells you you have a scoliosis after touching your toes like that, do not go into it. If you have a family history of scoliosis, make sure the child gets evaluated by a chiropractor, and make sure the child gets evaluated young. Do not wait for puberty to get the child evaluated. Do not wait for the child to be 18 and ungrown and get the child evaluated. Get the child evaluated when they're 10 or 11 years old and get a head start on it. Once the body has grown adapted to a scoliosis, that's your scoliosis. If we can catch it beforehand while you're still growing, there's a lot of chiropractors out there with some anti-scoliosis stuff they can do and make a huge change. But if we decide to wait, if we decide to see how long we can go before we do something about it, the longer the stress is on those vertebrae, the longer it is to get rid of it if you even can. There's a thing called Wolff's Law. Wolff said the more stress on the bone will change and adapt to the stress. If a child has a scoliosis, the weight's misproportional on the vertebrae. The vertebrae over time during puberty, during the growth spurt, will change their shape to adapt to the stress. It is really hard to reverse a scoliosis curve after this has happened. Catching it starting to happen in the beginning or before it happens is huge. So if you have a family history of scoliosis, make sure you get a scoliosis checked by a chiropractor who takes x-rays. If you have no scoliosis history in your family and you go to the doctor and the doctor tells you to touch your toes and they come up and tell you have a scoliosis, verify that. Diagnosis, please, with a chiropractor. Make sure that really is a thing. I just get upset about this as I think about how many kids don't go to that chiropractor, how many kids think they've got this thing, then they really don't. Make sure a chiropractor checks you out. This is everything a chiropractor does. If you went to your family doctor and you thought there was something wrong with the kid's tooth, and the doctor said probably not, you would probably still follow up with your dentist. If you went to your family doctor and your doctor said there's something wrong with his tooth, I want to take a procedure with it, you wouldn't advance that tooth care with that doctor. You'd follow up with your dentist. Use the same logic and the same rationale with the spine and this chiropractor. The doctor says they think they see something, follow up with the chiropractor, both for verifying it's actually there, validate it's actually there, and then if it is there, the chiropractor is the one that's trained to help you. For me, some scoliosis and young kids I work with are the ones I have a friend nearby about an hour away that can set you up with proper anti-bracing, anti-rotational stuff. It can make a huge difference in that spine as it's growing. And he's actually had cases where it's actually cleared up and reduced dramatically. So please, if the doctor tells you have a scoliosis, please check that up with a chiropractor that takes x-rays of your spine. There you have it. Get a little passionate about this, and I don't like seeing kids suffer because doctors refuse to work with chiropractors. So if I come off a little passionate, you know what, I am, because it is a big deal. All right? Well, there you have it, Ask the Chiropractor. If you have a question about chiropractic or chiropractic care, only one person could answer that, and that would be a chiropractor. Go ahead and leave a comment or message below if you're listening to this and you have a question you'd like me to address next week. Thanks, everybody.